All right, so for this deep dive, we're going to Nigeria and specifically looking at some concerns from healthcare workers there.
Okay.
We got a podcast actually called MedExpert TV, and they're basically ringing the alarm bells
Gotcha.
about these funding cuts for HIV treatment. And it seems like everyone is feeling the pinch.
Yeah, makes sense.
Patients, healthcare workers, everybody. So
Yeah,
let's jump in and see what they're saying.
absolutely. This podcast is it's really interesting because it's like directly targeted at healthcare workers in Nigeria.
Yeah.
So it gives us like almost a firsthand look at what's happening.
Right. And one of the things that Dr. Tundi,
Okay.
one of the doctors on the show, mentions is that,
Yeah.
with these funding cuts, patients just aren't going to get the medicine that they need.
Right.
And that means their health is going to suffer, and
Essentially.
it'll lead to more infections.
Yeah, I mean, it really makes you think about the progress that's been made with things like RT. Antiretroviral therapy has been so important in the fight against HIV.
Yeah.
People are living longer, healthier lives, and the risk of transmission has gone way down.
Exactly.
So to see these funding cuts, it's scary to think about how many people might lose access to this treatment.
And it's not just the medication itself.
Right.
Like, what about the economic side of things?
Oh, absolutely.
Like, people can't get treatment.
Yeah.
How's that going to affect Nigeria?
It's a huge issue. Untreated HIV can really impact a country's workforce.
Yeah.
Productivity goes down, healthcare costs go up. It puts a strain on social safety nets.
Right.
So yeah, the economic ramifications could be felt for years.
And then you've got, Amaka, one of the nurses on the show. She's really concerned about
Yeah.
the risks to healthcare workers.
Of course.
Yeah, fewer resources means they're more likely to be exposed to HIV,
It's a valid concern for sure.
especially during procedures and stuff.
Yeah, I mean, what kind of safety measures are in place for these healthcare workers?
Are they getting enough gloves, other protective gear?
Yeah.
What kind of training have they had?
Right.
These cuts could really impact their ability to stay safe.
Exactly, because they're the ones on the front lines.
Absolutely.
Drawing blood, giving injections, dealing with, bodily fluids and all that.
All day, every day, yeah.
I wonder if there are any statistics on, like, needle stick injuries in Nigeria.
That's a good question.
How does it compare to other countries?
I don't have those numbers off the top of my head.
Yeah.
But it would be really helpful to know,
Yeah.
just to get a sense of the scale of the problem.
Right.
But I think regardless of what those numbers are, the fact is these funding cuts are making a tough situation even tougher.
So what can be done? It sounds like the experts on the show had some advice
They did.
for both healthcare workers and patients.
Yeah, for healthcare workers,
Yeah.
they really stressed the importance of protective gear, using it diligently,
Right.
and just really focusing on infection control protocols. Even simple things like hand washing and disposing of sharps properly can make a huge difference.
And for patients, I think they were talking about the importance of education.
Yes, absolutely.
Like knowing how to protect themselves and getting tested regularly.
Exactly. And also being open with their healthcare providers.
Right.
Even with all these funding challenges.
Yeah.
It's about working together, finding solutions.
They also seem to encourage everyone, patients and healthcare workers alike, to advocate for themselves.
Absolutely.
To really raise awareness about this issue and push for solutions.
Yeah, and advocacy can take so many forms.
Right.
Writing to your elected officials, supporting organizations working in Nigeria.
Yeah.
Even just staying informed and sharing what you learn with others.
It all makes a difference.
It does. Every little bit helps.
It's crazy, thinking about the ripple effect of these funding cuts.
It's
not just about numbers on a budget sheet.
Right.
It's about real people's lives.
If people, their health, their ability to access care, it's really concerning.
Definitely.
It really makes you think about what's going to happen to Nigeria's healthcare system if these cuts continue.
That's the big question, isn't it? What's the long-term impact going to be?
Yeah.
It's something we all need to be thinking about, and maybe this deep dive is a good starting point to really dig in and explore further.
Yeah.
Are there organizations working to fill these gaps? What can we do to advocate for continued support?
Right.
There's a lot to unpack here, and it all goes back to that bigger picture of global health equity.
For sure.
It's a big issue,
Absolutely.
but it's one that we can't ignore.
Well said. Well, this has been really eye-opening.
Yeah.
Thanks for breaking it all down.
Of course, glad we can do this.
To all our listeners out there, thanks for joining us for another deep dive.
See you next time.
We'll catch you on the next one.
Bye.
Bye.